Hey, this is Doug Field along with my co-host Ron Bachman, and welcome back to this segment of Healthcare Consumerism Radio. We're pleased to have joining us today from Businessolver, Kori Orsinger, the Director of Client and Staff Management. Good morning, Kori.
Good morning. How are you?
We're doing fantastic. How are you today?
I'm doing great, thank you.
So you're going to bring us some real-time look-ins as to what went on, is going on in this fall's open enrollment period.
Yes, it's been a very, very exciting year with a lot of changes, and we've seen a lot of interesting activity as a result of that.
Yeah, talk to us a little bit about what what do you see going on?
Well, I think obviously, a lot of people are talking about, just because of what we're seeing in the media, what's going on with healthcare.gov and things like that. What we have seen is really something that's in contrast to, I think, what most people would expect. We've had great results from the use of our system, Businessolver, which is an online platform where members can go in and enroll in their benefits. And along with that, we've seen great trends like people using an online chat feature. We saw a 68% increase in usage of that this year, as well as an increased number of members that are using things like their mobile devices to enroll in benefits, which is something that we prepared for last year and saw an increased number of members that were accessing Businessolver and doing that benefits enrollment online using those tools.
Did you get a lot of questions coming to, although you're mostly involved in employer-sponsored healthcare, were you facing a lot of healthcare.gov questions?
We were prepared for them, and our phone system here in our service center was set up to redirect callers to healthcare.gov if they had specific questions. And our service center team can answer some very basic questions about the marketplace. So we were prepared for that activity, and we definitely saw some call volume in terms of members calling in with those types of questions. But I would say overall, the bulk of members that we had calling in were really focused on those their employer-provided benefits that they were working on.
What type of questions do you face? People are coming to enroll for 2014, but I'm sure you're getting questions as a confusion as to what's coming in the year ahead. Do you face many of those questions?
Yeah, and I think, obviously we faced more of that this year, I think, than ever before, but there's always an element of that that's present in any annual enrollment. Some of the research that's out there, and it may sound funny to say, it indicates that people put enrolling in benefits in the same category as planning for their funeral, which seems like a very odd way to classify that. So we know that consumers on the whole don't view this as a process that they're looking forward to, and there's a lot of confusion tied to that. So our callers really kind of run the gamut. We have a lot of folks that may call into our service center who are somewhat benefit savvy, and they may just have a few minor questions about what they're enrolling in. And then we definitely see some of those people that call in either to our service center or leverage that chat feature who have in-depth questions about every benefit that they're enrolling in and really want to understand those plan options and what those mean for them and their family in the coming year.
Hey, Kori, this is Ron Bachman. How you doing?
I'm great, thank you. How are you?
I'm terrific. I just want to be sure that our listeners understand your business. As Businessolver, you talked about some of the ways people are doing their enrollment. Do you also have the underlying technology platform? Is that a proprietary system for yours? And who do you market and sell to?
Sure, we do. So we have Businessolver, which is our online platform. It's a one-stop shop for benefits enrollment that allows members to go in, not only enroll in annual enrollment, but also to gain access to information about their benefits. So it's an enrollment tool, but it's also a communication tool and a resource for them to get that information that they need. It's also a tool that COBRA members use. We have a lot of COBRA members that not only enroll on our platform, but can also make their COBRA payments and then access that same information regarding the benefits that they're eligible for. Businessolver, in terms of marketing that Businessolver platform and some of our other services like the Service Center that I have been talking about, really focuses on companies out in the market, mid-market and large market, which, varying sizes of clients who are looking for a resource and a partner to help them with benefits administration, to help them with that communication and education to their members, which we do through Businessolver, but we also have those other services, as I mentioned, in place in an internal marketing and communication team that works really closely with our clients on some of that strategy around how do we talk to our members around what's available for their benefits, and then how do we help them to enroll in those for the coming year.
So how does this draw some parallels? Everybody's been hearing the news about the dysfunction of the healthcare.gov website and inability of people to get on, and they say they can handle 50,000 people at one time, and you probably have a whole lot more than that just in your business from the many employers. Draw some parallels to the type of things that you're able to do versus what you understand the healthcare.gov site was doing, and why doesn't the government program do and have some of the same capabilities that your system has?
Sure. I would say it probably comes down to a couple of different things. The first being that as we were preparing for annual enrollment, there was a significant planning process in place, including thousands of hours of analysis of system performance and service center usage and those things from last year, and then preparing for that volume for this year. So we did significant testing and capacity planning around exactly what needed to be in place. The result of all of that was that we had a system that was able to enroll. We enrolled over 1 million members just in the month of November. And when you talk about how many people can go in and enroll in any given day, we had individual days with over 2 million web page hits just within that one day. So when I mentioned earlier that we had members that called in, we still see that the bulk of individuals will just log in online. They will use Businessolver for what it's meant to do, which is be that intuitive tool that kind of leads them through the process. So when I talk about that tool piece and the other part of your question, which is what else could they do, we have a really, really heavy focus on the education and the communication side of how are we helping those consumers who are afraid to roll in their benefits and don't understand them get through that process. And so for us, it really, here at Businessolver, it was really about that overall communication strategy, educating the employee on what's available, educating them on where they can go to enroll, and then once they're actually logged into Businessolver, having all of the resources, information, and answers to their questions right there at their fingertips so that they don't have lingering questions and they aren't confused about where to go. It's all right in front of them, and they can really get that information as they're moving along.
So the big issue that we keep hearing about on the government website for enrollment is security, that a concern that, you do little patches here and there. If you don't test the system from end to end, there's all sorts of security potential problems of losing all your private information. When people are enrolling, they're giving you some very personalized information that if somebody wanted to, get their Social Security number or their addresses, telephone numbers, information that would allow them to hack into accounts, get into their bank accounts. How do you protect that? What kind of security issues have you been able to build in, and what are the major issues that some of our listeners should be thinking about security if they're going to a government website or a government exchange?
Yes, so you are absolutely correct. We house a lot of very, very important and personal information for our members, and it's one of the core focuses of our leadership team in terms of protecting that information. So there are a few different things that occur. One of them being everybody that is at Businessolver, that is an employee that has access to that information, is certified in the security requirements for that data. On top of that, and probably even more critical, is really understanding what measures the organizations have taken to protect that information. So here at Businessolver, when we're looking at all of the data that's housed in Businessolver, we go through significant security measures every year. We're audited by a third-party administrator who comes in to look at our system. There's a certification that's called SAS 70 that most consumers probably wouldn't be familiar with, but that's a security requirement that Businessolver meets every year that says, yes, we have gone through and everything in Businessolver and in the database of our information is protected to the absolute maximum requirements to make sure that nobody else can get access to that information.
That's good, Kori. Kori, let's turn our attention to the private market and employer-sponsored health care. And, we're just coming back from our IHC Forum West last week in Las Vegas, and a lot of discussion around defined contribution and the evolution of private exchanges, and some really positive feedback coming out of this first enrollment period from how private exchanges are working. How is Businessolver either executing an exchange or working with some of the exchange players?
Sure. So I will tell you that we have some clients that we have worked with for many, many years that use Businessolver to administer healthcare to a lot of different organizations in a setup that is very similar to what the exchanges are now that more people are aware of how those are administered. So the model itself is something we're incredibly familiar with. From that, what we are doing is we are working with others to administer some of those personal exchanges. From a requirement standpoint and a system usage standpoint, we're leveraging the technology that's already in place. So Businessolver as a system is already able to support all of the requirements of that administration. So it's just working with those partners in helping them to administer that same type of program.
It's kind of interesting because I led a share session out at West, and one of the major outtakes in the share session around exchanges is our exchanges simply benefit admin on steroids.
Absolutely. And sometimes it feels that way, right? As you're listening to how they're being administered and who's getting involved in doing them. When you do have some of that information, that knowledge of what others have already been doing, you can definitely see where we're transitioning into just that kind of a model.
Yeah, I think there's some really interesting around that model, some really interesting new decision support tools being put in place that really adds a lot of value to that consumer and really helps the employer in distributing benefits. I mean, let's face it, exchanges are simply a benefit distribution platform. Exactly.
And like you said, I mean, that communication piece, that educating the consumer so that they know not only what they're doing, but they also know what the great benefit is that they have, especially if it's something through their employer or what they're choosing through that exchange. It really is something that benefits everybody in understanding what we're doing with healthcare.
Kori, we got about 30 seconds or so to go here, and I want to give you a chance to leave our audience with some takeaways, a couple thoughts you'd like to leave them with.
Sure. Well, I would say from our research perspective, we know that employees spend an average of $4,000 out of pocket on benefits every year, while employers are investing a significant number on top of that of around $19,000. We know that those costs are expected to rise next year and that we need to continue to help drive that educated consumer so that they know not only what benefit they have in place, but what is going to be the best thing for them and their family. And so for us, leveraging Businessolver and some of those communication opportunities is really the best way for us to help support that process and that incredible benefit that they are receiving from their employers.
Well, Kori, listen, thank you very much. I wish you a very Merry Christmas, and send our thoughts to John and the rest of your team at Businessolver.
We will absolutely do that. Thank you so much.
Take care. And,
okay,
and stay tuned for the next segment, Healthcare Consumerism Radio.